Hi guys, welcome to another Your Health is Lit session. I'm Sharla Walker, aka the PDNP.
I'm Donna Williams, aka the Public Health Queen.
And you're Kim.
And I am
So we are so excited today to have a really, really good friend of mine, Miss Kimberly Williams.
Hello.
Oh, we have the same last name. We might be related.
Oh, come on now. Come on, Donna and Kim. So Kim and I met each other in our NICU days back at good old St. Louis Children's. We made fast friends. We've done a lot of shenanigans together. And I recently was in her wedding.
Woo!
Yes. So we are doing our breast cancer discussion today. And you're probably like, oh, Kim works in the NICU. Like, why is she here? Kim, tell them why you're here.
I'm here because I'm a breast cancer survivor.
Yes. So even though I know people are probably like, what? Because you're like 30.
Yeah, I'll be 33 next month.
Good shit.
Yes.
Why did I think you just turned? Whatever.
No.
Time is flying. It's escape. I was like, I think she's like 30. Yes. So Kim was diagnosed a couple years back. And so, with her being a Black woman and a young Black woman, we just thought it would be great for her to come on and share her story and how it's impacted her life and just navigating the whole process with her, being a nurse and having the knowledge and like what advice she would give to others. So this is a really, really, I'm going to make it through this without crying. It's a really it's crazy because at the time where Kim got diagnosed, we were talking a lot about it because my grandmother, her breast cancer came back and had metastasized to her lung. And so I was like calling Kim, like, they said this and like, what worked for you? What didn't work for you? And so I'm just really glad that Kim would take some time to come on and talk to us and share with us, because I remember there were lots of times where Kim's like, what's going on with Granny? Like, tell Granny we got this. So, and I know that Gigi really appreciated talking to her and just enjoyed talking to her. And yeah, man. So we are here to, let's talk breast cancer. Let's talk some stats. So all women are subject, we all have breasts and can get breast cancer. But with Black women, we get breast cancer at the same rate as white women. But unfortunately, we don't, our survival rate is poorer than theirs. So we, compared to white women, Black women have lower rates of actually getting breast cancer, but we are dying from breast cancer more. And so that math doesn't add up. And so we are just here to talk about it, talk about different interventions and things that we can do, because death from breast cancer is going down, but the death rates are 40% higher. That's almost like 1.5, that's almost 50%, that's almost half the rate, which is alarming. We don't get it as frequently, or we're about the same, but our chance of dying from it is 40% higher than our counterparts. And so it's definitely something that I feel like we need to address, and address the early warning, the warning symptoms and things that we can do. So Kim, can you just tell us a little bit about how you were even diagnosed, or a little bit of your story?
I was actually diagnosed on September the 1st, 2015. It was in August of 2015. I had actually just came back from my job interview from where I work at now, and I was just doing my monthly breast exam, and I'm like, wow, it's a lump over here that, I didn't feel the month before. So I'm like, let me just call my primary doctor to try to get an appointment to see what's going on. So as soon as I told them I felt a lump in my breast, they was like, oh, we have to get you in. So they got me in, and at first, they were like, well, maybe, since you're so young, it may just be caffeine deposits because, of course, I drink a lot of coffee.
Starbucks.
Yes.
We were the
Starbucks
Gold card.
Yes.
Kim had a Starbucks Gold card. I was like, how you get one of them? She got me hooked on Starbucks.
I did.
The stars.
It was
Yes.
so bad. Working night shift. Kim, like, we lived like 5 minutes from each other. Kim's like, we carpooling and let's go to Starbucks.
Yeah.
Yeah, man.
Yes.
I just like the caffeine. I was like, we drink so much coffee.
Mm-hmm.
Much.
Yes. So, but the nurse practitioner I saw, because my doctor was actually out of town at the time, she was like, "Oh, I'm just gonna send you for an ultrasound, just to make sure." So they did an ultrasound, and they saw something that didn't look quite right. And at the time, they had to fight with the insurance company because I was 29 at the time, and they were thinking, "Oh, what a 29-year-old need with a mammogram." So they decided to do an invasive procedure of a biopsy rather than to try to do a non-invasive procedure with a mammogram before they would even diagnose me. So they did the biopsy, and once the biopsy came back positive, that's when they actually decided to do the mammogram.
Insurance drives me nuts.
I can.
Like I said, I was 29, and they were like, "Oh no, you don't need a mammogram." So
At 29, right? And that's something that's like hard that a lot of people don't they don't talk about. Is like the disadvantage that we have socioeconomically. Like, Kim, you're a nurse. We had good insurance. At children, like, we had good insurance, and even still, I feel like I've had some times where I've ordered something for a patient, and the insurance is trying to fight me, and I'm like, look, buddy, like, you're not in the room with me when I looked at this kid. Like, this needs to be ordered, and all of the rigmarole and stuff that you have to go through, and you're wasting time, like valuable time, and so that's ridiculous. So your diagnosis, was it the triple negative? Like, what stage and diagnosis?
I was actually the estrogen positive, in which they want. That's the good one. And I was only stage 1 at the time. So I remember that Friday when I went in to see my doctor, Dr. Herman, she was waiting for the results as I came back to the back. And once she got the results, she kind of like screamed like, yes, that's a good thing, because we didn't want it to be the triple negative. So it was actually the estrogen positive one.
Okay.
Yeah.
So when you found that information out, what treatment options were you offered?
I was offered at the time, it would be, first off, they would have to do a lumpectomy to get the cancer spot out, to test it, to see what was going on with that. So I did the lumpectomy, and she told me at that time we had to wait till the test results come back to see if I would have to do radiation, meds, chemo. It was just a whole bunch of information thrown at me at one time. And they also took one of my lymph nodes to make sure it hadn't spread to a lymph node, because if it had spread to a lymph node, chemotherapy would have been the first thing I would have had to do. But I was blessed, and it had not spread to my lymph nodes. So all I had to do was the lumpectomy, radiation, and now the tamoxifen therapy is 10 years instead of 5. So I have to do 10 years of the tamoxifen.
And is that just a pill that you take like by mouth, or is it
by mouth daily? Yes.
So I just have one question, because I noticed you said that you were checking and you had the lump. Is this something that you were just doing all the time, like doing your self breast examinations? Or I know because a lot of people are so young, like in our age range, in the 20 age range, we don't normally need to do we need to do our own self breast examination, because sometimes like I don't even do it. So it's like I think that we need to make more people aware that we should be doing this, you know, even though we're not getting a mammogram, do your own self breast examination, or talk to your primary doctor about it, or because we don't do that.
Right, yes, and it was just my monthly self-exam that I usually do every month.
Mm-hmm. Yep. So, and what's really important is, like, I've seen kids come in, particularly young girls, where they find these lumps. Like my younger sister, Kayla, ended up having a lump, and it was a fibroid. So sometimes you can get those, you know, those fibrous lumps in your breast when you are like with their cycles. So it'll happen with their menstrual cycles with young girls, but it's still important because she found the lump and then went to my parents. It was like, hey, something is wrong. Like, something is wrong. And even with that, they did the ultrasound and confirmed that it was just that. But don't ever ignore a change in your body. It could just be like a change in your nipple appearance. It could be discharge that wasn't coming. Like, do not ignore that stuff, because we have these symptoms, but things aren't always as they seem. You know what I'm saying? Like, you could have a cough, and the cough could be a cold, the cough can be tuberculosis, the cough could be cancer. So it is, you know, something that we really want to emphasize. Like, make sure you are doing your breast self-exams. Do them monthly. Do them in the shower. Make sure that you're looking at your breasts like they're yours. Yeah. They're yours. I just feel like, you know, even when we talked about like breastfeeding, this over-sexualization of our bodies, where people are like, oh girl, you know, I don't touch them. Like, they're your breasts. You should be checking. And
how often should we check?
Monthly.
Monthly?
Yep, every month. Because it could be different. Some people do it like more often. I check mine more often because I'm on birth control. So I don't even have a cycle for it to go with. So I just be checking. I'm like, what's up down here? Because you can feel while you're in the shower. Like you're in the shower while I'm washing, I just take a quick second, like, okay, no lumps, bumps, nothing weird. Okay, on to the next thing. Because, you know, with not only did my Gigi have breast cancer, but my aunt ended up getting diagnosed after Gigi got diagnosed. So it's something that it runs in our family. Like, it runs in our family. I went as far as going to, at Kim's advice, going to see a geneticist. Kim was like, just go, because Kim, it didn't run in her family.
I was the first one diagnosed. Wow. And all my genetic testing came back negative.
Yeah. So it can still happen. And I just, you know, it just is like, take care of your bodies. Like, we get one body, just one. So take care of your bodies. You know, like with my Gigi, she ended up having a mastectomy, and so they ended up having to take one of her breasts, and we had to do like the prosthetics and we did a couple different things, but you know, it just is something like so simple, you know, that you wouldn't think, you know, like taking the time to look at your breasts and know the contour, and if they change in any way, to be, you know, we pay attention to so many other little things, and we know every other challenge that come out every other week. But like, can you do the breast self-exam challenge?
We need to make that a challenge.
We need to. Like, can you
check? Check on your body.
Primary prevention. We don't practice primary prevention, is what it is. Yeah. We don't do that until it's too late.
Make a song like boobies, do you love me? like what do we need to do? Because nobody is doing it. Yeah. And it's just really crazy. And so so I know we talked a little bit about like estrogen positive and triple negative breast cancer. So triple negative breast cancer is more aggressive, and of course Black women are more likely to get diagnosed with triple negative breast cancer than white women are. So that's why, like, getting in early, like Kim, you know, she caught it as stage 1. Getting in early and doing those regular routine exams. And even when you go in, this is why it's important to do your well woman exam. Let's say you don't do your BSEs. if you go for your paps, when I get my pap done, my OB, she be out here, she does her own exam on my breast. Like so even if you're not going to do it yourself, even if you're like, you know what, I'm not doing that, make sure that you go and you get your annual paps and you go see your OBGYN and at least let them do it.
Yes.
Because like why risk something, so great? Because it's a lot.
Definitely is.
Yeah.
So I know that you're a medical professional. So did that make your treatment any easier or more difficult?
Kind of more difficult, because even I'm a medical professional, I was all on the internet looking up things that I wasn't, that how they tell you not to Google anything. I was on the computer like Googling, and I don't know. It was just different. Like some people may think, oh, she's a nurse, she'll be fine with it. But no, it's something new to me, something out the ordinary that I'm not used to dealing with. So,
Right.
Yep.
Okay.
So I think, like I always tell people too, it's like we know too much.
Right.
Like, so when we were going through right before we moved, and my Gigi was complaining of having, a more difficult time with her breathing, and she was like, well, they've given me these inhalers, but the inhalers aren't working. And when we went to that appointment, I texted Kim because they were like, well, they were going to run all the tests, make sure that it wasn't when we did the x-ray. I saw the x-ray and I was like, and I remember I texted Kim and I was like, Kimmy, this is not, I don't think it's TB. I just don't. And, like just having to brace myself because I already had, like, I feel like I knew too much. I already knew what this was. Like, I already knew, but let's run the test because maybe, because God knows. And honey, they came back. I was not surprised. And it makes it hard because we know, we see both sides of it. Okay, had they told Kim, like, yeah, you need to do chemo, we know both sides of chemo. People, we know all the things that can happen with chemo. Like, we know too much. We know too much. If you can never have enough education, but I feel like it makes it harder. Even dealing with the stuff with Gigi, it made it harder because we were constantly trying to make sure, I'm like checking this and checking that, and well, what about this level? And I'm like, I'm looking at her labs, and because I'm looking at every little thing,
Right, when you're on the other side, it's kind of like now you're panicking. You're thinking, what if I have this? Because I've been a victim sometimes when I'll have these symptoms and I'll go on Google and I'll be like, I'm about to die. Damn well, I'm not about to die. Diagnose myself and be like, I got this going on, and just panicking.
Yeah, so, I mean, the education is twofold, and I think that, okay, I have hypothyroidism and just got diagnosed this year. I kind of, I knew about hypothyroidism. I'm like, okay, I have this weight gain, and I have this. I feel so exhausted. I was so tired all the time, and I could not put my finger on it. And so I'm like, you know what, let's just go get the labs done. And I went to go see my doctor, and he was like, well, your labs are a little off, but my liver enzymes have started to shift. And I was like, actually, doc, even though my labs are off, they're trending down. I was like, if you compare with my labs from the last time, I went back and compared my labs from 6 months ago. I was like, if you compare with my labs from the last time, and sometimes untreated hypothyroidism can lead to stress on the liver. So it's probably why my and I'm telling him. And so in that sense, it's, it's good to know what you're talking about. Because I'm like, actually, no, if you compare it to my last from April, it's been 6 months, my numbers are trending down, they're probably going to continue this way. So you can go in and you can be armed with that knowledge. But it is scary on the other side because I just want to be a granddaughter. And this is my Gigi and I love her. And I'm having to think like a nurse and also think like a granddaughter. So during the whole meeting when her doctor set us down and we're talking about all of these different things, I had to keep it together. Once we dropped her out, like, we went out to eat afterwards, went to Steak and Shake. It was her favorite restaurant, had a milkshake, right? Like, we went out to eat afterwards, all that. Honey, I dropped her off home and was bawling. Because while we were in the office, I was, the medical proxy. So I'm like, okay, she wants to do this, but she doesn't want to do that. And I'm like texting Kim. I'm like, they're talking about doing something. And Kim's like, no, no, I don't think she'll like that. Don't do that. So whatever meds they would offer, I'd be like, Kim, have you heard of this? Did you take this? What were your side effects? And just having, Kim and I both having each other to kind of like lean on, it brought my Gigi some comfort, because I'm like, well, Kim said she took it and she didn't have any, she didn't notice anything to where she couldn't function, because my Gigi's big thing was like, she had done the chemo before and she didn't want to do chemo again. She's like, if I'm going, like, she said it made her feel like she was going to die. And if she was going to be feeling that way, she wanted to really be dying. She was like, no, I don't want to feel like that. So we did the estrogen therapy, because Kim was like, oh no, like, it's, it's good. I haven't noticed anything big that I couldn't deal with. And so since we had Kim, who had done it and was going through it, Gigi be like, okay, I'll try it. She wasn't gonna do nothing she didn't want to do now.
Oh no.
I don't know. Kim, I was like, Kim, she ain't doing that. Like, they had talked about at some point doing injections. I was like,
no.
Like, she ain't going for that. Not one time. Not one time. Kim, can you just talk about how, like, your diagnosis, I think, I always say that in a lot of these situations, like, in any situation and in every situation, there's a reason, and God always has his, like, divine reasoning. Can you talk about your divine reason as to your diagnosis?
Why I think I got it? Why did I think I was the chosen one for it? Well, a year after I found out I had breast cancer, my mom was diagnosed with breast cancer. And she went in and did her mammogram. They saw some abnormal things in her mammogram, and they was like, oh, maybe it's just, calcium deposits, whatever. So her doctor was like, well, your daughter did have breast cancer, so let's go ahead and just do a biopsy just to make sure. And they did a biopsy, and lo and behold, she was stage 0. So I feel like if I had not had breast cancer the previous year in 2015, she probably would have been walking around with breast cancer for a whole year and not even knowing it until maybe like her next mammogram for 2017, and it had spread.
Yeah. So I remember when you called me, like, my mom just got diagnosed, and at first they weren't even going to diagnose her, but because I had a history, and at first there was no family history. And then, like, a lot of the, Kim fits none of the risk factors. Kim has never smoked. She doesn't drink, like, she doesn't drink to the point of, like, cancer. Like, you know what I'm saying? Like, like, she doesn't smoke, she doesn't drink. She is healthy. You see, she going for all her appointments, honey. Kim ain't missing no appointments. Kim is, like, the risk factors that you think are there, it doesn't run in her family. All of that stuff is missing. And so just solely on the fact that Kim got diagnosed, they call her mom at stage 0. Like, oh, come through, Jesus.
That's good.
Come through, Jesus. So, it's important to like share the family history. I remember I was gung-ho. I was like, I'm going to the geneticist. We're going to get all of our family. I'm going to figure this out. We're like, girl, my mom was like, you are doing a lot. I was like, because this is crazy. And, I'm going to go and find out. And so it really depends. On average, every woman has about a 13% chance of getting breast cancer. I think it's anywhere between 11 and 13%. Why? Because you have breasts. Because of the diagnoses that happened in our family, the geneticist determined it would be like, I was more in like the 25% chance percentile, which is good, which is good to know. Kind of helped my nerves because I was like, do I have the BRCA1 and 2 gene? I don't want the BRCA gene. Take all my blood. So the BRCA genes are genes that you have, and you're at a very high risk. I think it's in like the 70%. Like if you have the BRCA gene, your chances of getting breast cancer are really, really high.
Yes.
And so I was like here for it. I was like, poke me, take all the blood, because if this is something that I can prevent, like my little sister from getting, or, so my mom knows that, to go and get more mammograms. And what's crazy is like my husband went with me to the appointment, and the geneticist got to talking to him, and he ended up having to get genetic stuff ran because both of his parents had breast cancer, or had cancer. Andre's mom had breast cancer, and his dad had brain cancer. And you're like, that's a little bit that's kind of scary because both of your parents had cancer. The lady's like, I really want you to come back and make an appointment. And so even in all of this happening, I'm like, it's helping us make better decisions going forward, like having kids.
So how do you think that your diagnosis, how do you think that impacted your family? Since you were diagnosed with breast cancer, then later after your mom, so I'm pretty sure she was your support system and you were her support system.
Yes. So yes, it has impacted us because a lot of the women in the family now, they're checking their breasts like more often and being more cautious and everything. So
yeah. And can you just talk a little bit, Kim, about on the other side with because you were recently married, the planning that you guys have to do when you were talking about wanting to have kids?
the which planning? The
kids, babies.
Oh, the baby planning with the whole having breast cancer. Yeah. I have to come off of the tamoxifen for has to be off for at least 3 months before you can even start trying. And then they usually kind of sort of try to give you a time frame because they want you back on that medicine as soon as possible. If you want to breastfeed, they'll give you those 6 months to try and breastfeed. But usually after a year, if you aren't pregnant, they talk about sending you to fertility specialist to see what's going on. But they don't think my chances were harmed or anything since I only did radiation and didn't do the chemo.
Mm-hmm.
So, and the only thing that they were talking about with me, because I do want to breastfeed, they don't know how the breast that I had cancer in will respond until that time comes, because they don't know if the radiation damaged the breast or if the milk ducts were cut during the operation or what. So
yeah. So it just goes to really show how this isn't, it's just not a one and done thing, right?
A domino effect.
So now it's affected, because wasn't there a time, there's a certain time period after radiation too, right, that you have to wait, or was it just the tamoxifen we were talking about?
It's just with the tamoxifen, because they don't want you trying to get pregnant while on it. And that was another thing. I was never really a big birth control fan, but then after the radiation and having the breast cancer and being on the tamoxifen, I had to go on birth control. But since I had the estrogen positive cancer, they actually had to find a non-hormonal birth control to put me on. So I was actually had the Paragard IUD, which has no hormones. It's just the copper IUD.
So now let's talk about some joyous things, right? So you were married. Yes, at the time. Darren, we love Darren. You guys had just, so when you got diagnosed, she was leaving St. Louis. She was leaving me, my friend.
I
She
was.
was leaving St. Louis and moving. They moved to Georgia. And we were right out the door right after. Because I think you guys like left in October, and by April we were in Florida. I was like, we are out of here. Everybody.
Mhm.
So can you talk about your Susan G. Komen experience?
Yes. So the Susan G. Komen walk I did the first year after I got to Savannah. So we got here in October. I did that the April of the following year because one of my coworkers, who I call Miss Connie, my mentor, because when I got to the hospital I work at now, she was actually a 5-year survivor at the time. So she was like, "Oh, you should come and do the Coleman walk with me this year." And I was like, "Oh, okay, we can do the Coleman walk." And it was crazy because everyone but me knew that at the finish line, when I finished the walk, that is where Darren proposed to me at.
Yay!
So yes, they had the news. He had no idea that the news or anything was going to be there. He just thought that's where he was proposing. So yeah.
That's so awesome. And man, I really just urge everybody to, like check yourself, know what's going on with your health. Like that's why we have these conversations. Um, I will, definitely say on the other side of it, so like, Kim is a breast cancer survivor, whereas, well, I always say that my granny survived. My granny's a breast cancer survivor because she did it the way that she wanted to. Um, and being on the other side of it, being a nurse, I'm like, do your breast self exams. But like y'all, for the sake of y'all's families and y'all's grandbabies and y'all's great grandbabies, because I have I'm not going to say a void, but there is a part of me that I am so sad that my kids, because we don't have babies yet, will never get to experience like my Gigi. And she was something that, like, there'll be stories and pictures, but Kim,
Yeah.
like you had to experience her, Donna. Like,
Girl, when I seen the picture, she just looked like she was like the life of the party. I
girl,
told
you just had to
you.
experience her. And it tears me up sometimes, like to the point of tears. Not that she wasn't doing what she was supposed to, but had, I been more involved or had thought about it, because it came back. It was something that we dealt with in 2006. She got she got surgery, she did this stuff. We were chilling, but just making sure that you're doing those follow-ups and making sure that, you know, she went to her primary, and her primary is like, oh, it's probably COPD. And they gave her inhalers. And it's so crazy. And that's just with anything. If something is wrong, like,
Listen.
keep pushing.
Yeah.
Because
Because
the patient knows
the
what.
you
It's like no
know.
one know your bodies but you. And I hate when like a lot of like I work in the healthcare field too as a health coach. It's like a lot of my patients go to their doctor and their doctor just kind of blow them off and just like, oh, nothing is wrong, just go home. And it's just like I wish sometimes that as healthcare professionals like that we would just listen to our patients. If they say something is wrong with them, take it serious. And it doesn't hurt to like check it out or whatever. But it's like we know our bodies, we know what's going on, we
Right.
know how we feel.
Right. And that's why we made this platform, because not only, the healthcare professionals, I will say that I've had some people, not where I work at now. I really, the place where I work at now, my coworkers are like they're very good at like listening to their patients. But I have seen, even Kim, us being nurses, when some of these moms come in here that look like us and the nurses don't look like us, they're very quick to write them off. But what I want to do, and the mission, my mission is, as a part of Your Health is Lit, is like to arm you with the knowledge. Like there was a reason I was at them appointments with my grandma. Because you're not just about to tell her anything, sir. I'm telling you she's taking her meds, she's doing this, she hasn't smoked in over 20 years. This is not COPD. There is something else going on here. Here are the symptoms that we're having, and this is what we need to deal with. And so that's when they ran the gamut. And so, but I can't be at every appointment with every person ever.
Right.
And so it's important when we have these conversations for us to arm you guys with the knowledge to do and have these conversations with your doctor. Now, what you can't do is come in here cutting up. Because if you go in there, well, I told you, like, we're not going to listen. I'm not going to listen to you. You come in cutting up. Because there's a way that you come and approach these things. I told you, no. You're a lot less likely to have my attention. I'm going to think you crazy. I am. I'm like, girl, this moment, Kim, we done seen her. I'm like, girl, come get your auntie, tell her quit cutting up in this hospital. But we want to arm you to where you can come in and say, hey, doc, look, you know, I've been having this, and this. I've tried this, and this, and it isn't working. What's next? Because I'm having, you know, I always tell people, like, keep tabs on yourself. If you have headaches, keep a headache journal. If you're having chest pain, like, write down what you're doing, what things make it better. So when you go to your doctor, you can say, I'm having this many episodes of this. This lump on my breast, it was the size of a dime, and now it's the size of a quarter, and you told me it was fibroids, and it never went away.
Right.
Let's get this taken care of. So shortly after, and when I say, like, shortly after my Gigi passed away, my husband's aunt passed away because her back pain that she'd been having for several months turned out to be cancer. And they're giving her pain meds and telling her to go home. And it frustrates me that and not all hospitals are bad, not all doctors and nurses and medical staff are bad, like, right? Because look at us three. But it frustrates me that there was not a nurse there that was like, she's here a lot for this back pain. Like they hadn't even done an x-ray. And they did the x-ray and they found cancer. And she passed away like the next week after my grandma passed away. And she was young. And it makes no sense. So make sure that you're checking yourself. Make sure that you're checking your family. If you don't understand something, ask questions until you understand it.
Yes.
Because they couldn't have just walked in like, hey, Kim, you got breast cancer, bye.
Right.
No. You're like, no, sir, I need you to sit down and speak with me. I need you to talk to me. I need you to explain what things are going on. I mean, and if you know, there's a lot of things, us being Black people, that we shouldn't have to do, but we have to do things certain ways, right? Like when the cops pull us over, there's just a certain way that we have to be. I thought my hair looks crazy today. And there's a certain way that we have to be. I'm getting worked up. There's a certain way that we have to be when we go to work. There's a certain way that we have to be. And the same thing goes when you go to these appointments. Like, there's just a certain way that you have to be. You can't come in there cutting up. Well, I read on Google, they're gonna shut that down. They just are. But if you're just speaking to them like, look, I have this, and that going on. I've tried this, and that, because they're looking for objective things. You have to know how to speak the language. And so, you know, we're hoping and working on some things to where, you know, we are hoping to help people learn how to speak the language and to better navigate their health. But it starts with you taking care of yourself. If you don't know that breast cancer is killing us and you don't even do your breast self-exams, I don't want to hear nothing when your breast turns into a rock. Because you should know. You should be checking yourself. Even if the doctor isn't checking you. You can switch doctors. But you can't get a new body. So take care of the one that you have. And yes, I'm on a soapbox because this stuff, like being on the other end, like, I miss my Gigi every day.
I was just about to say preach.
I miss my Gigi every day. And it sucks. I wish she could have lived to be 175. She didn't want that. She was like, I'm not trying to be that. I used to tell her that all the time. She's like, I ain't trying to be that old. But it just is like, you know, Andre's aunt Like, Andre's cousin just got married. They don't have kids. That was her only son. And it's because we need to take care of ourselves and make sure that we're advocating for ourselves. We say nobody should know you better than you.
Be your own advocate.
Be your own advocate, because everybody doesn't have a Kim or a Donna or a Sharla that's going to come in and ask these questions. And so we just want to arm you guys with the information, because it makes no sense that we're at a 40% higher rate of dying. How do we bridge that gap? Because if somebody's not offering you something like, look, I watched this thing and I know there's radiation and there's oral meds and you need to know. And so, well, how come I'm not being offered radiation? And you ask that question, even if it makes them uncomfortable.
Right. Because I sure asked if I would have to have chemo and what was the percentage of it coming back if I didn't have chemo. And the reason I didn't do chemo, because it was only a 7% chance of it coming back. Okay, I'll take 7% rather than put my body through
Chemo.
Yeah.
Side effects.
Yeah.
Mm-hmm.
And so but you asked those questions.
Right.
And you made an informed decision. And that's the thing. Like, ask these questions, y'all.
Right. Because they'll just throw it all at you.
Yeah. Like, did you have a notebook, Kim, or did I make that up? I know Gigi had a notebook, and we would write everything down.
Oh yes, honey, I had it all. Yeah.
Yeah.
And I brought it to when I moved back to Georgia. I brought it down here because I started it in St. Louis, and each doctor I went to, I had them writing stuff down or either giving me papers on it. That way, when I got here, I could say, hey, this is what we discussed when I was here, this, and that. So, yeah.
Yeah. Like, you should have a notebook on yourself, a journal, a health journal, whatever it is, to where all your health information is in one place. Nobody could walk up to Kim and be like, what's your dose of tamoxifen? She'd be like, oh, wait, let me think about it. Like, you know that stuff. All of my meds that I take, I know what they're for, why I'm taking it, how often I'm supposed to take it. I know when I'm not being compliant, and I'll be like, yeah, look, if my TSH levels are off, I may have slipped up and not been taking my levothyroxine as but you should know.
Mm-hmm.
You should know your dose. You should know why. You should know how. Like, you should know. Well, I'm on this one medication. Really? How do you know that it's not like jelly beans? Like, how do you know? People I don't understand it, y'all. And I'm gonna come off my soapbox, but I just say all that to say that I, like, on the other end of this, being a remaining survivor of a family member who passed away from breast cancer. It sucks. Like, it sucks. So my Gigi is a part of the 40%. That sucks. And she was treated and was fine and was in remission and was good for 11 years. And then it popped back up, because you can never stop listening to your body, ever. It's yours. So if you knew one time at band camp this happened to you 10 years ago, that's something that you need to remember. Like, I was diagnosed with hypertension. Okay, so if I get really bad headaches, the first thing I tell them is, like, I have controlled hypertension. So don't even come to me telling me it's my blood pressure. I take my losartan with hydrochlorothiazide every day. I take 100/25 milligrams. So it's not that I drink plenty of water, because I can come in and tell them what it's not. Like, it's not that. Something's going on outside of me being a brown girl with high blood pressure, because I feel like they're very quick to go to the fundamental things that Black people have. Like, oh, girl, you got high blood pressure. Here's some aspirin. No. If you're taking your meds the way you're supposed to, like, oh, no, I don't get these headaches like this. I haven't had a headache like this in years because my hypertension's controlled. And they go do a brain scan, and it's cancer. Mm-hmm. This is why it's important to know.
So important.
I'm putting myself on punishment now. I'm sorry. It's on my soul, y'all. It just is like, it is, because even with my Gigi, like the doctor couldn't just come in and say whatever to her, and I was so proud of her. Like he couldn't just come in like, oh, we're doing this, and that. No. You're gonna have to explain this to me, and after you explain it to me, you have to explain it to my granddaughter. Like you're gonna have to explain it, so then she can then explain it to me again. So even if you don't know, bring somebody with you. If you don't feel like you can keep up and you can advocate for yourself, bring somebody with you who can. It got to a point where my mom, when I moved, I couldn't be at the appointments, so my mom would record them. And we really didn't make a move until I had a chance to listen to them. And I'd be like, okay, I understand what they're talking about. This is what they mean. This is what they're saying. But they would record. I've been on 3-way calls, recorded calls, like had stuff, like my mom would record the stuff. So if you can't remember when you get home what the doctor is saying, it's as simple as taking out your phone and pressing record.
Yeah.
And that's it. That's my lituation tonight. That's my lituation.
Okay. So, after sharing your story, what things would you like our listeners to take away from your story, and what advice would you have for someone who is recently diagnosed with breast cancer?
My biggest thing is to know your body. Don't let the medical professionals try to tell you this or that. Tell them, I didn't have this at this time and it's here now, and can someone please check it out? And with breast cancer, do your monthly exams. Get a buddy. Make sure your friend is doing their exam as well every month. And for someone who's newly diagnosed, like, get all the information you can before making like any type of decisions. Don't just let the doctors tell you, well, you have to do this, or you have to do that. Just get all the information, go over it to see what's best for you.
Okay. Do you have any resources that you use, or any organizations like support groups that you know of for breast cancer awareness or breast cancer survivors?
I usually go through the Komen, and
Okay.
they usually can reach out to other individuals. So, yeah.
Okay, that's good.
Thank you, Kimmy.
No problem.
Another website is Bright Pink too.
Okay.
Bright Pink is a really good website. I used to do some work with them and do presentations for them on breast cancer awareness and ovarian. And also on Bright Pink, they have like a little risk factor test that you can take, a little quiz. So that's really neat. So Bright Pink is a really good one too also. And we'll put some information and resources in the group.
We're always here for the resources. Y'all, look, let me just tell y'all, check your body.
I'm going to go check my breast tonight.
Yeah, you need to. Like, check your body. Because it sucks. It sucks. Kimmy, I know I was going to ask you.
Mm-hmm.
Didn't they suggest for you to get a mastectomy, or was it at some point you were like, they want me to do like a radical mastectomy, and you were like, no, I'm not doing that?
Because no, that's why I say no. Go and research. Like I say, for that, and then like the chemo part, I'm like, so give me some percentages here. What?
Yeah, because I remember Kim was like, they're talking about taking my boobs and giving me implants, and I was like, but you look fire though. I'm the silly friend. I'm a silly friend. No, but honestly, like, they gave you some very radical, because she was so young, they gave her some very like radical, like they were like, just go ahead and do a radical double mastectomy. And Kim was like,
no, thank
you. Kim was like, no, I'm not doing that. But she did the research. It's all about making informed decisions. And so, like, Kim knows, she was like, there was a 7% chance. Okay, that 7%, I don't think that what chemo will do to my body is something that, I want to do. Make an informed decision. Don't be out here at your doctor's appointment like, your health is listed, don't do chemo. That's not what we said. No. We said make an informed decision and do what's best for you. For my grandmother, doing chemo probably would have been beneficial, but she was at the age and the point to where she felt like her body could not take that. And so we then made a decision and a plan based around her decision.
Mm-hmm.
And in doing that, we were still able to achieve her goals. She had certain goals set as to, and what she wanted the rest of her life to look like. And I am very happy to say that with her oncologist and her hospice team, we were able to do that. That's my comfort in all of this. Like, she did it her way. Gigi, like, that's what she wanted. She did this whole thing her way. So make sure that you're listening to your body. Everybody's circumstance is different, but they will come to you like, cut the boobs out, do this, do that, chemo, do everything. And Kim was like, slow down. Let's talk about this. So don't feel like when you get a diagnosis that you have to make a decision that day, because there's so many things. Kim, did you did your oncologist, did they offer any type of like counseling or anything like that to you?
They did, and both in St. Louis and when I got to Savannah.
Yeah. So, breast cancer is more than just a physical thing. Make sure that you're taking care of your mind. Make sure you're taking care of your family and how it weighs on your family. There's so many things to take into account that we want to make sure that we are, we're covering all of our bases. So don't feel like you have to make a decision today about your treatment. How is that going to impact your kids? What is, there are so many things that you have to take on. Make sure that you're one step at a time making the decisions that are right for you and your family. Guys. Breast self-exams. I'm going to find a video of somebody doing a breast self-exam and post it in the group.
I think that'd be good.
Yeah, it's easy. You literally can do it in a matter of minutes. The time you take trying to beat your face, you could have done 10 breast self-exams and potentially saved your life. And we're going to do the BSE challenge.
Oh, that's good.
I'm going to come up with a song we need to call Drake. Like, we're going to come up with something. There is the Susan G. Komen walk. There's also like the Sister Strut. I don't know.
American Cancer Society.
American Cancer Society. So if you guys are looking to get out in your community and you're looking for camaraderie or you're looking to help raise money for these organizations, those are the people. Like, you can find something that floats your boat. Unfortunately, I really wanted to walk this year, but unfortunately I will be out of town.
I'll be walking for you and your Gigi and
Thank you. Yeah, I'll be out of town for one of my friends is getting married, so her bachelorette party falls on that weekend, so we'll be in Las Vegas. Yeah, so we also have the Faces of Breast Cancer honorary video. So Kim, I expect to see you in it.
Alrighty.
So if you guys are interested in that, we're just going to be honoring people who have had, may have had. So if you have a friend, auntie, cousin, it doesn't matter how they're related to you. If you want to share their, a piece of their story and have them in this video, it's something that we're going to do every year in honor of my Gigi, which I could have a whole 3 hours, 5 hours, about how much I love my Gigi. And I'm really proud, and I know that it's something that she would be proud that I'm doing. So we want to honor other people and just show, because people don't know, Kim, you young. This can happen young, old. This isn't just happening to our grandmothers. This is happening to our friends.
Cancer doesn't discriminate.
It doesn't. Cancer doesn't discriminate. So, thank you again, Kimmy. Donna, do you have anything else to add?
No, this was probably, all of them are my favorite segments, so I can't pick one. But this has really inspired me to go do my breast self-exam, and I hope it inspires others as well And we have to remember that preventative care is the best care.
Yeah, we should probably do something talking about primary, secondary, and tertiary
We
care.
should, and the differences between them and stuff. We should.
Probably just don't know.
Yeah.
Always have new ideas. Kim, thank you so much. We hope
You're
that
welcome.
you enjoyed your time at the Your Health
did.
Lit table, at our round table. We hope to see you back again.
All righty.
All right. Thank you.
All right. You're welcome.
Thank you.
All righty.